Well, obesity continues to ravage America. We are the number one obese nation in the world, not getting any better, in fact, getting worse. All the signs look very, very bad, and that's because the medical system has failed us, the government has failed us, because they're giving us misinformation. The government and the medical system wants you to believe that being overweight and obese is due to lack of exercise and eating too much. Well, we followed that theory for 75 years, and all it got us was number one. Oh, yeah, we're number one obese nation in the world. So obviously it's time to look around. And I've known since 1978 that obesity is really due to a nutritional deficiency. And the symptoms of overeating and cravings and the munchies are all just symptoms of mineral deficiencies. Every mineral deficiency, no matter what mineral it is, any one of the 60 essential minerals, when you're deficient in one or more of them, you're going to have cravings and the munchies. There's two of them. If you're deficient in one of these, you're going to be a 300-pound person. If you're deficient in both of them, you're going to be one of these 400, 500, 600-pound people. So I urge you to get a hold of that book, Hell's Kitchen, and really look at this. The subtitle is The Cause, Prevention, and Cure of Obesity. It also discusses type 2 diabetes and the metabolic syndrome. And then when you get the book, Hell's Kitchen, from your Longevity associate, ask for a free copy of the CD by the same title, Hell's Kitchen. Now, what you can do is several things. You want to lose a half a pound to 2 pounds a day? With our program, you can do it. Everybody does it, right? A half pound to 2 pounds a day. It takes about 2 to 3 days in the system before it kicks in. Now, you want to get on the Healthy Start Pack, 1 per 100 pounds of body weight. Kind of, if you weigh 175, go with 2 Healthy Start Packs. You weigh 280, go with 3 Healthy Start Packs. You weigh 195, go with 2 Healthy Start Packs. Okay, you got it? Then I want you to get the Slender Effects Meal Replacer. Only 110 calories, no sugar. Great for type 2 diabetics, type 1 diabetics who need to lose weight. Guess what? The Slender Effects, you make it with water, throw a couple of eggs in there. It's a 300-calorie meal. All right? And you take 2 of those a day. 2 meals a day, you got 600 calories, and you can throw in another meal with just salad and a little piece of meat or fish or chicken the size of a deck of cards, and you have 1,000 calories, anywhere from 900, 800 to 1,000 calories a day. And then you throw in the ASAP. As slim as possible, as soon as possible, put those drops under your tongue, 1 dropper full, not a drop, but a dropper full under your tongue 30 minutes before each meal, and you're going to lose weight, a half a pound to 2 pounds a day. It is glorious. As long as you stay on your minerals appropriate for your body weight, you'll never gain the weight back. That's the magic. Well, here's another little kicker. You get on a gluten-free diet, right? No fried foods, no processed meats with nitrates, nitrites, no deli slices, no sandwich meats, absolutely no oils, no olive oil, no coconut oil, no margarines, mayonnaise, salad dressings, cooking oils. If you eat canned fish, you got to be packed in water, mustard, tomato sauce, not oil. And then no gluten, no wheat, barley, rye, or oats. I just had another lady yesterday, was talking to her about a health challenge for her kid, and the child had to be gluten-free. And guess what? She did it, obviously, so the whole house will be gluten-free. And she lost 30 pounds in a month just going on a gluten-free diet. She just couldn't believe it. And that's even without the supplements. Now she's kicking in the supplements. Now she's excited. She just went on a gluten-free diet, and she lost that much weight because you're going to absorb nutrients. You can absorb more nutrients. The whole problem is you can't absorb nutrients. You can absorb calories, but you can't absorb nutrients. So when you're minerally deficient, you're going to have more cravings. So you eat more carbohydrates, more sugar. Guess what? You gain more weight. And, of course, you're still, especially if you're eating carbohydrates, so your wheat, barley, rye, and oats, cookies, pies, cake, soft drinks. I mean, it's kind of crazy. Replace those soft drinks with Rebound. Even the diet soft drinks, replace with Rebound, or our weight loss Java Fit coffee. You're going to lose the weight, keep it off. That's the magic, because when you're taking in your minerals, the munchies, the cravings, the binge eating all go away because they are symptoms. Again, remember, cravings, munchies, and binge eating are symptoms of mineral deficiency specifically. Want another book to really get into this? Get the book called Rare Earths Forbidden Cures. Read chapter 4, 5, and 6, and then go into chapter 11 on the minerals and look up 2 specific minerals. Guess what they are? Iron and phosphorus. Now you say, well, phosphorus, that's in everything. There's not even a single supplement out there except for longevity supplements that has phosphorus in it. It's so common. It's ubiquitous in everything we eat, phosphorus. Well, how could you be deficient in phosphorus? That's because you have a gluten intolerance. You can't absorb it. And when you're deficient in phosphorus, you're going to eat the furniture. You will eat anything, okay? You'll eat the rug. You'll eat the dog's food when the dog ain't looking. You'll eat the Tootsie Rolls out of the kitty litter box. I mean, and of course, when you are phosphorus deficient, that's because you have a gluten intolerance because you can't absorb what's commonly in your food. It's very, very simple. Now, you can actually make a living by helping people lose their weight. Once you lose this weight, I've had people lose 20 pounds in 21 days just because they switched out their diet soft drinks with Rebound. Rebound, because you're going to get the minerals in Rebound. Remember, our Rebound, our sports drink, has 100 nutrients in it, including 77 minerals. Let's see here. All other sports drinks have anywhere from 2 to 6 nutrients in it. Let's see, 2 to 6. How does that stack up to 77 minerals and 100 nutrients? Doesn't stack up. So replace your soft drinks, replace the juices you're drinking, replace just plain water, right, with Rebound, and that's going to get rid of the cravings, the munchies, the binge eating, and then, of course, you get on your Healthy Start Pack, appropriate body weight, the Slender Effects weight management system for monitoring and managing portion and calorie control. And if you need to lose 50 pounds or less, 1 bottle of the ASAP per month will be perfect. If you need to lose 51 pounds or more, get 2 bottles of ASAP per month. Put a dropper full under your tongue 30 minutes before each meal. Put a second dropper full under your tongue 15 minutes before each meal, and you'll lose a half a pound to 2 pounds a day. It's going to be magic. Your friends are going to say, "What are you doing?" And there's your first customer. Well, hang on. We're going to be back with more Truth, Justice, and the Longevity Way on Let's Play Doctor and Dead Doctors Don't Lie after these messages. Okay, Doug, what pearls of wisdom do you have for us?
I thought we'd talk a bit about antibiotics, as I've got a story here from Fox News. It's headlined, CDC, Hospitals Contributing to Rise of Superbugs. And this is a new report out from the CDC that says it's shining light on how hospitals are contributing to the problem. They've long been warning about overuse of antibiotics because of the rise of drug-resistant superbugs. According to CDC Director Dr. Thomas Frieden, an infectious disease expert, says prescribing antibiotics varies widely among hospitals. Said about half hospitals patients receive antibiotics during their stay. There is a significant rise in the rate of antibiotic prescription. Some hospitals are prescribing up to 3 times as many antibiotics as others, according to this report that's been published in the CDC's publication Vital Signs. And they say Clostridium difficile, or C. diff as it's known, causes diarrhea, and mostly causes infections in patients taking antibiotics. Reducing the use of high-risk antibiotics by 30% can lower deadly diarrhea infections by 26%, according to the report. And the director, Frieden, says the overuse and misuse of antibiotics is contributing to an increase in drug-resistant bacteria. He says he actually recalls treating patients who had run out of antibiotic options because they'd taken them all. And saying in an effort to protect antibiotics, CDC has released suggestions for hospitals and state and local health departments to improve prescribing practices. It is 2 broad strategies. Hospitals are being asked to implement a 7-step checklist that includes tracking current prescription practices, reporting patterns of drug-resistant bacteria, and educating staff on more effective use of antibiotics. The CDC also suggests physicians order tests before beginning to treat a patient, keeping careful notes about the course of treatment, and checking the patient's status 2 days later to ensure the antibiotics are working properly. And, we've talked about this before on the show, Doc, that, I've known of cases of where someone had a viral infection and they got antibiotics, and antibiotics don't even treat viruses.
That's exactly right. And, of course, most of the time when people get antibiotics in the hospital, it's because doctors didn't wash their hands after they went to the bathroom and gave the infection, like MRSA, to methicillin-resistant penicillin. These Staph aureus, I guess, methicillin-resistant Staph aureus. These bugs are caused by, these infections are caused by doctors not washing their hands after they go potty. Another one is Clostridium difficile, C. diff. 30% of the deaths are from C. diff. It's a human poop bacteria. That's the only place you can find it. And so these patients are being infected, and whether they go there after the surgery, during the surgery, just from their daily care. Doctor comes in after getting blood and poop and pus all over himself, and he brings it into the room next door without washing his hands. This is where every patient should be issued PureWorks spray and foam, liquid soap and lotion. The nurse, the doctor comes anywhere near you within an arm's length, you spray them with the PureWorks and get all the bugs down on their surface of their skin and clothes. Certainly you want to use it yourself. The odds are, if you take care of yourself, you take your 90 essential nutrients, keep your resistance up, support your immune system. I take 2-3 killer biotic twice a day just for prevention. That's our blend of 8 herbs that support the immune system. It has, 2 of the 8 have the antimicrobial properties. Also, the Envision colloidal silver, it kills everything. There's no bug that can survive with colloidal silver. Okay, and the nice thing about the colloidal silver, it doesn't sting. Even open wounds, ulcers, it doesn't sting. And it actually encourages healing. There's a property in it that actually encourages healing as well as killing all the bugs, bacteria, viruses, fungus, and yeast. And so these are the things people need to use. I mean, we need to take care of ourselves before you get to the hospital. You don't need to go to the hospital. If you do, for any reason, have to go to the hospital, like in a car accident or something, you fall off a roof, you better have your family bring you the Envision colloidal silver. The PureWorks whole a range of products, the liquid soap, the lotion, the spray and the foam, the killer biotics, your 90 essential nutrients, and really watch it. When those doctors and nurses come in the room, they head for you, scream, back off, head over there and wash yourself from head to toe, change clothes before you touch me, you filthy person. Okay, then they won't need antibiotics, or the doctors and nurses won't perceive they need antibiotics. That's how to prevent problems with antibiotics. Well, stick with us. We'll be back with more truth, justice, and the absolute final word on Dead Doctors Don't Lie after these messages. Okay, Doug, let's go to callers.
Let's head to Kentucky. And Deborah, you're on with Dr. Wallach.
Hello, Deborah. You're on the air.
Yes, I'm calling about arthritis.
Okay, you're talking about arthritis? Did you say arthritis?
Yes, sir.
Okay. Is this in yourself?
Yes, sir.
Okay. What type of arthritis do you have?
I have a lot of it in my feet and beginning to get it in my hands.
Okay. Now, is it osteoarthritis, bone-to-bone arthritis? Is it rheumatoid arthritis?
It's not rheumatoid. I do know that much.
Okay, good. Okay, how old are you, Deborah?
60.
Okay. And let's see, how much do you weigh?
I weigh 200.
Okay, and how tall are you?
5'3".
Okay. All right, this is a Shar thing. Now, Shar's been with me for 25 years, and so would you listen up here, Deborah? She's a little bit shorter than you, about 5'1", I think, probably. And Shar, what would you recommend for Deborah?
She needs 2 of the healthy bone and joint packs.
Okay.
But, she probably should get on a gluten-free diet just in case.
Okay. Yeah, I think she'll lose weight just on a gluten-free diet just because. Yeah. Okay. And what else would you throw in between, besides the 2 healthy bone and joint packs for the weight loss?
ASAP.
Okay, good girl. All right. Now, one other question here, Deborah. Do you have any history of skin problems, any eczema, dermatitis, psoriasis, rosacea?
No, sir.
Okay, good. Do you have any history of anything like respiratory problems, asthma, bronchitis? Hello?
Yes, sir. No, I don't have any problems with that.
Okay. Do you have any children?
Yes, sir. 2 that are grown.
Okay, good. Do any of them have those problems?
No, sir.
Okay, good. All right. Well, why don't you get on a gluten-free diet anyway, because you don't have, other than the weight problem, which can be a symptom of gluten intolerance. And so once you get on a gluten-free diet, as Shar recommends, perfect, that's right on her part, and once you get on a gluten-free diet for 90 days, and then no fried foods, no processed meats with nitrates, nitrites, that means no oils, no margarines, mayonnaise, salad dressings, cooking oils, no wheat, barley, rye, or oats, and then the 2 healthy bone and joint packs, as Shar recommends, which is going to support and promote healthy maintenance, repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone matrix, bone itself. And then I would also throw in the ASAP. I'd have you take it 5'3". I'd like to see it weigh 125. So minimally 1 bottle a month of the ASAP. Put a dropper full under your tongue 30 minutes before each meal, and you'll lose a half a pound to 2 pounds a day. And if price is not an issue for you, get a second bottle of ASAP so you can take a second dose of the dropper full of ASAP 15 minutes before your meals also, and that will speed up the weight loss process. Give us a call every 2 weeks, Deborah. Let us know how much you weigh. Let us know about your arthritis. We'll walk you through this. We'll be back after these messages.
Let's head to Washington State. And Lisa, you're on with Dr. Wallach.
Hello, Lisa. You're on the air.
Hi, Dr. Wallach. I have a question about, in your book, you mentioned scabies. Well, I have myself and a couple of family members have been dealing with it that we caught at a friend's house, and it's been months now, and they keep coming back. Doctors, dermatologists give us toxic creams and stuff, and so we don't know what to do. We're just like...
Okay, well, let's stop a minute. Did anybody see these scabies underneath the microscope, or are they just doing it from symptoms?
I went to a dermatologist, and he did say that I had it.
Okay, now let me back up here. Did he take scrapings on your skin and look under the microscope?
Yes.
Okay, he said he saw scabies.
Yeah, that's what he said.
That's what he said. Okay. So what I want you to do is go to the feed store where people buy chicken feed and chicken dusting powder. And what you want to do is look for chicken dusting powder that has pyrethrums in it. These are little daisies, and the pyrethrum daisies actually have the ability to repel everything from ticks and mites, which are scabies as mites, little kind of almost microscopic ticks. And you want to dust this pyrethrum-containing chicken dusting powder at the baseboards on your rugs. Go away for a weekend and leave that powder around there, and come back and vacuum the place. Then, a week later, do it again. A week later, do it again. You're going to get all the hatchlings, and they won't get old enough, as some of them do hatch, they won't get old enough to be able to lay eggs. And usually it takes a while to get rid of all the eggs and all the hatchlings and stuff. At the same time, you want to, when you wash your clothes, use our Ancient Legacy Deep Cleanser. Okay, Deep Cleanser is a blend of herbs and aromatherapy oils that actually not only smell good, but they kill bugs and actually repel insects and arthropods like mites and ticks. Also, doesn't hurt to use the peppermint oil. Peppermint oil also repels them. You can put a few drops along the baseboards and so forth. If you have a dog or a cat in the house, this is where you want to brush that pyrethrum poultry dusting powder through their hair and put it in their bed. It's totally harmless because just about you look at a chicken the wrong way, they get sick and die. And so these poultry dusting powders are designed to get rid of the feather mites and lice and so forth in chickens without doing them any harm or having it come through into the eggs and getting the people who eat the eggs. So that's what we recommend there. Okay, Doug, let's go to callers.
Let's head to Wisconsin. And Heidi, you're on with Dr. Wallach.
Well, Heidi, you're on the air.
Yes, hi.
Hi.
Thanks for taking the call.
Hmm?
Yes, my daughter has had something called pandas over the last 4 years. She was diagnosed with severe OCD when she was 12 years old.
Okay, you have to back up and tell me what the first one was. It sounded like pandas?
Yeah, like the bear pandas.
Yeah. No, you have to tell me what that is when we come back. We got to run to one of these messages. You have to tell me how it manifests itself. We'll be back after these messages. Okay, Doug, we're going right back to Wisconsin and Heidi. Okay, during the break, Doug helped us look it up in the medical dictionary, panda. Are we talking about things like motor function and facial tics?
Yes.
Okay, now.
My daughter actually has severe OCD.
Yep.
And she has excessive hand washing, showering, redoing, inability to think, to do homework at all.
Okay, let's stop there a minute. I'm going to back up a little bit. Did this come on her? I understand also she's 16 years old. Did this come on her when she was 12 or 10 or 8, or was she born this way?
Yeah. No, it came on when she was 12. Suddenly. All of a sudden, we saw her just staring into space, and she couldn't concentrate and she couldn't think to do her math homework, and she just sat there for hours and hours and had an inability.
One more question. When you look at when you say motor function, now is she paralyzed or in any way? Or?
No, she's not paralyzed, but a very strange thing happened. Her posture became very hunched over, and her arms just kind of hung by her sides, and her hands curled up under her, her wrist.
Sure, I understand. Okay, now
and
what did your doctor tell you?
Chorea.
Yeah, I understand. Okay.
Okay.
Like Huntington's chorea?
Yeah, a little bit like that. It kind of looked a little like that.
Okay.
But not as
so what did your doctors say? I already know what they said, but what do you, for our audience, what did the doctors tell you?
The doctors initially just told us she had OCD. And then a year later, she got her wisdom teeth out, and she got a staph infection from the hospital. They put her on strong antibiotics for 3 months because she had cellulitis in her face, like Ludwig's angina, basically. And then she got C. diff. And then after that, it was strange because her OCD had gotten better. So I looked up this information about pandas, and it looked as if this might be what she had because the prescription is antibiotics as a prophylactic to help protect the brains of these children so that they don't have these motor tics or OCD symptoms as badly. But they really haven't figured out the exact cause of pandas, or they believe, that it's an autoimmune issue where the body's attacking the basal ganglia of their brain. And then another doctor has a theory that it's an alternate fever response. So basically, her immune system
they don't know
properly.
Yeah. Okay.
Yeah,
they don't
she
know.
didn't have an IVIG. So one panda's doctor gave her IVIG. It actually worked immediately. We saw an immediate change in her. But
Okay, now what did they give? Wait, whoa, stop. What did they give her in the IV?
It was like immunoglobulin.
Okay, did they give her any vitamins and minerals? Wait a minute. Whoa, stop. In this IV, did they give her any vitamins and minerals or any electrolytes?
Oh, I don't know.
We need to find out what they gave her.
Well, I know that they gave her immunoglobulin.
Okay, well, that's not going to give her immediate relief. Okay, so one other question. Well, two questions here. As a child, did she have any asthma or respiratory bronchitis or anything like that?
No, but I have psoriasis, so I know she's gluten intolerant now.
Yeah, she's gluten intolerant. Okay, very good. Does she have any skin problems?
Yes, she has bumps on the back of her arms. They're white bumps.
Yeah, okay. Yeah, that's called keratosis or fish skin or shark skin or that sort of stuff, goose skin. And Shar, what caused this?
A gluten intolerance for sure.
Yep. And Mama's got it. Do you have any other children, Heidi?
Yes, I do.
And do they have any skin problems or bronchitis or asthma?
Yes, he does have skin problems. He has dandruff, but now I'm wondering if it's psoriasis.
Well,
I just read the Wheat Belly book like a year ago, and we stopped gluten. But my son is out in California, and I'd have to talk him into stopping gluten.
Yeah. Well, he's got gluten intolerance too, but he won't pass it on to his children. Your daughters, when they get old enough to have their own children, they will pass it on to them if they don't get on a gluten-free diet. Okay? And so it's imperative that everybody, including yourself and your husband, man, mother-in-law, dog, cat, bird, fish, everybody in the household has got to be drop-dead gluten-free. I'd get them, including your daughter. What's her first name?
Her first name is Emily.
Emily, okay. Emily needs to listen to that CD called Serial Killers, because it'll tell her where all the hidden gluten is. Okay, it's in everything from meatloaf to meatballs to gravies. It's a filler in pepperoni and salami and bologna. It's a filler or a thickener in tomato soup. It's in everything. It's even in some yogurts and ice cream. So you got to read labels. I mean, even if you get a bag of nuts that says these are drop-dead gluten-free, and then you roll over and you look at the allergy stuff, it says these nuts have been packaged on machinery that also packages wheat products. Well, the dust in there is wheat. And so you really got to watch it. Okay? And so this could be just the bottom line of this whole thing with your daughter. Get her on a gluten-free diet. And what does she weigh?
She now weighs 205. She gained 90 pounds
How tall is she?
in 2 years. She's 5'4".
Yeah, she's definitely got a gluten intolerance here, so she needs to be gluten-free, 205 pounds. What would you give her, Shar?
I guess just a healthy.
Well, her brain needs help here.
Healthy brain and heart pack.
Yeah, 2 healthy heart and brain packs, perfect for 205 pounds. And get her on a gluten-free diet. She will lose weight. Get her on 2 healthy brain and heart packs per month, a full dose for everything at breakfast, full dose for at dinner. I'd also get her the de-stress capsules, have her take 3 of those twice a day. That's 2 bottles a month. That's going to give her all she needs for metabolism of the brain. And then also, I would give her Immortalium. I'd give her 2 of those twice a day. And what would you do for the weight loss, Shar? ASAP, you got it, girl. A+. Okay, and so I would give Heidi, at 5'4", 16 years of age, I would give her ASAP, a dropper full under her tongue 30 minutes before each meal, and I'd give her a second dropper full under her tongue 15 minutes before each meal. But don't forget, she's got to have all this nutrition so she loses the weight healthfully. And she'll lose a half a pound to 2 pounds a day. And I want you to call us every 2 weeks, because I know you're going to see something dramatic. And she's one of these cases where she could be one of our poster girls because she has such a complicated background here, and yet the answer is so simple, okay? And all these doctors are milling around because they have no earthly idea that the basic underlying factor of this whole thing is a gluten intolerance. I would like to know her blood cholesterol level, if you have that, if they've taken a blood test. I'm sure they have. I would like to know what her blood cholesterol is, okay? Not because I'm worried about it being high. I'm worried about it being low, okay? I've seen these kids with blood cholesterols of 90, and the doctors think that's good. It should be over 220. Should be 220, 270 is normal. And when you get down below, like, 200, you're in trouble, and you start getting OCD. You get Huntington's-like stuff. You get MS. Even kids her age. I've seen 12-month-old babies with MS because they had gluten intolerance and couldn't absorb all the right stuff. Give us a call every couple of weeks if you would, Heidi, and get this young lady, Emily, on the good stuff, the 90 cents of nutrients, get her off all the bad stuff, and call us every 2 weeks. Okay, we'll be back with more Truth, Justice, and the Youngevity Way on Dead Doctors Don't Lie after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Youngevity and 90 for Life Crusade. And Doug, let's go to callers.
Let's head to North Dakota, and Bill, you're on with Dr. Wallach.
Bill, you're on the air.
Hi, Dr. Wallach. Thanks for taking my call.
Yes, sir. What's up?
I just want to give you a progress report. I called a while back for alopecia, and the bald spots are going away.
How long ago was that?
About 3 weeks ago.
Okay, so you're already seeing some regrowth of hair.
Yep.
Okay,
So
good.
That's great. And then I had a question regarding the cleanse and the Mighty 90.
Okay. And what's the question?
Well, just in conjunction with, or do I need to do it separately, or what?
No, the 90, of course. Did you take the Healthy Start Pack, or did you take the Ultimate Classic? What multiple did you take? Yeah. Okay, well, that's the 90. Okay?
Okay.
It actually has 245 nutrients in it, which includes all 90 essential nutrients. That's part of it. So it's included in that. Okay? The cleanse, did I recommend for you the Herbal Rainforest?
No, I've just been interested in the cleanses, though.
Okay. How much do you weigh, Bill?
180.
Okay. Well, 180, if you want to do a cleanse, you can actually take a tablespoon, which is a half ounce of the Herbal Rainforest, which is a liquid. It has 14 legendary cleansing herbs in it, including Cascara Sagrada and Taraxacum, both of which are just drop-dead legendary, plus the 77 liquid minerals. And, Shar, you use Herbal Rainforest, don't you?
Yes.
And what does it taste like to you?
Peaches, it tastes great.
Yeah, it tastes great. And anybody who's either constipated or has a history of working around chemicals or solvents, detergents, even household chemicals, like some of these chlorine bleaches and things like that. You've done painting or anything. You could do that on Tuesday and Thursday every week for the rest of your life. Some people add it to their program with the 90 for Life program, with the Healthy Start Pack or the Pig Pack or anything like that. Every night they'll take anywhere from a half ounce to an ounce of the Herbal Rainforest. 1 quart will last you 2 months if you take a half ounce, which is a tablespoon. And if you take a full ounce, of course, that 1 quart will last you a month. I'd always start out, unless you weigh 250 pounds, I'd always start out with a tablespoon, a half ounce, because I don't want people to get diarrhea because of 14 cleansing herbs in there. One of the things that will happen when you got to cleanse and you're not used to taking it on a regular basis, you can actually get diarrhea, and that oftentimes will put people off. Well, I'm not going to do that again. So I'd rather just start you conservatively. Take a half ounce, which is a tablespoon, every night when you go to bed with a glass of water. And if you're constipated, you'll have a nice bowel movement the next morning. If you're not constipated, you just have 1 or 2 bowel movements a day. You might move up to 2 or 3, which is not bad, 1 after each meal. And especially if you work around chemicals of any kind, paints, solvents, chemicals. You work in offices with lots of machinery, and you have all these printers and inks and so forth. They're spraying around aerosols. It's a good idea to cleanse. And, of course, the Herbal Rainforest is legendary. It's used all over the world. And, of course, these 14 legendary cleansing herbs, which in the old herbal terms they say liver cleanse, blood cleanse, and colon cleanse. And what it does is it moves things along, and it actually helps your body eliminate through sweat and bile from your liver, through urination, and also through bowel movements, things that shouldn't be there. And I just love it. I try to get a couple ounces a week of the herbal rainforest. Like Char says, it tastes great. It tastes like peaches. Even little kids love it. So if you have little kids with constipation because they have gluten intolerance, it's a real blessing. Of course, little kids, you want to give them a teaspoon. If they weigh, say anywhere from, maybe 75 pounds and up, I start them out with a teaspoon. Anything below 75, I wouldn't give it to a little kid unless, they have a drop-dead constipation, but then there might be another problem, so you need to be looking at that too. Well, thank you, Shar. Super job. Thank you so much, Doug and Rich. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.